Stages of your dental career. Hello all, I am Dr. Rikin Merchant speaking to you on behalf of Dentapreneur 1.0, Be the Transformation. Stage 1. Launch. When you pass out from a dental institution, what is going on in your mind? You're highly motivated, you're highly energetic, you want to do something big, you're going to try and do something different. You are also looking at, apart from these emotions, you're also looking at other emotions on the side which are eating up your head, like anxiety, nervousness, and you want to create an identity of yourself, which is where you are kind of delving between two different thoughts. What you're doing is you're trying to look at different courses, you're trying to uplift yourself by getting in some more clinical skills. At the same time, you're trying to check for gaining experience by maybe working at a clinic or observing or working under somebody and pick up those skills. At the same time, you're also looking at exploring different possibilities. In what manner can you set up your practice, where you can set up your practice, or with whom can you work, and you're trying to seek different suggestions from people. While you're doing all these things, there are multiple issues that you face in reality while you're outside meeting people. What you face is you might face rejection. You are always clouded over with the fear of saturation in the field. You feel that maybe there is lack of opportunities in front of you. You feel there is a difficulty in decision making. You also have problems when it comes to comparisons of your setup with somebody else's setup. And that is where at times, maybe at a younger age, depression starts to set in. Stage 2, growth. Finally, we've set up that clinic or we've started our consultations and we are interacting with people, we are interacting with various doctors and we are interacting with our patients. What are you going through during this phase? So there is the thought of survival, the question of survival always at the back of our mind. There is insecurities that we have which are clouding over our mind. There is a fear of failure. What if this does not happen? What if that does not happen? There is maybe a discouragement from a lot of people. Seeing our peers, we feel that we are not doing up to the mark, so we feel kind of discouraged. And there is confusion in our mind as to whether am I going in the right direction, in the right fashion or no. While we are facing all these, what we do is we end up maybe copying others. We see what our neighboring dentist is doing, or we see what is the trend going on somewhere else, or we see what is my fellow batchmate working in some other city doing, and we end up copying others. We enter in a comfort zone, assuming that yes, the practice will take time to settle. The practice is going to take some months, years to stabilize, and that is how it is going to happen. So we enter our comfort zone and stop taking efforts at all. Then we end up criticizing others that fellow does not do the right kind of practice, and that is why I'm not getting appropriate patients. That is where that criticizing others also results into a blame game. And while you have these thoughts and these actions in your mind, the situations that you're facing is you have to end up managing finances because you've set up a clinic, maybe you've taken a loan. That debt is also that debt is also piling up in your head. We might face a medical emergency, and these medical emergencies can take away a huge chunk of our money or savings. There is stress piling up, and multitasking. While we try to do multitasking, it causes loss of quality and control because we think that I am the only one, I am the Superman, and I will do everything, but that fails. Stage 3, we call it the shakeout, or here at Dentapreneur, we like to call it as the gung-ho phase, where everything seems to be very happy, everything is green, the grass is green everywhere, it's all pleasant. We are looking up to the optimism because yes, we've achieved certain goals in life, and that is where we are on a plateau phase where we see that we've achieved a few goals and we are going to be achieving a few goals. Everything seems to be so rosy, but that is the time when stage 4 is looking forward to set in. Stage 4, maturity. Maturity is where overconfidence or our ego takes up our mind. We enter an extra comfort zone because we've been doing a lot of work, and that is where we feel that I am doing enough, I don't need to do more, I've been doing enough and this is more than enough for me, and lack of time sets in. We feel that I want to do so many things, but I don't have the appropriate time. These are the peculiarities of stage 4. While you have these thoughts in mind, what you're facing is you're facing your ignorance, spending increases largely, and complacency sets in because we know that we've been doing a lot. While all these actions and thoughts are in your mind, the situations that you're facing at work is that you have a stagnancy in work because when the growth phase was there, you were seeing that the number of patients was increasing gradually and there were higher number of patients coming in. But the number of patients has now reduced down or is achieved a very stagnant level. You have difficulty in time management. You don't reach your clinic on time. You don't maybe meet up your appointments on time. and that is where you feel that there is a lack of time management happening to you. There is also a lack of saving. There is no fund flow. There is a very high debt to income ratio. Our income is stagnant, our income is steady, but our debts are very high because we have a lot of EMIs to pay because we've bought a lot of things. Stage 5, declining phase. A sense of declinement sets in. We have, what our mind goes through is, we have a sense of fulfillment that we've done so much, we've achieved a lot, but still we are looking at what next, what more. Our mind is still craving for more. Then there is lack of interest. Lack of interest causes irritability and maybe depression sets in. What we do from this is, we maybe take frequent day offs from the clinic, because maybe if we have an associate working at the clinic, we let them work, we take a day off. And otherwise, towards our thoughts, we are not taking any other actions. Those thoughts are just moving around in our mind. And the situations that we face are piling up in this phase. Suddenly there are medical emergencies, there are sudden other expenses, maybe educational, maybe at home. You never know what pops up. There is increased debt as usual that is going to keep on piling up. There is reduced saving because we think that we might just take a chunk from our saving and meet the current expenses and then we'll save later on, but that never happens. And a very important thing that stares us in our face in this phase is we have no retirement plan. So what stage of dental career are you in out of these 5 stages? These 5 stages might seem to be the norm. They might seem to be normal, but that is not the truth. If you honestly ask me, I would not want to be in any of these stages. I would want to be in a stage where I am making the vision for myself and achieving my goals with the right kind of training and skills that I undertake. Here at Dentapreneur 1.0, what we are going to train you on is achieving life skills and putting in certain frameworks and systems into your life, into your practice, and combine your dental practice and you as individual being an entrepreneur. So you become a Dentapreneur. Be the transformation.